Welcome, my name is Sibongile Nkosi and I am one of the co-executive directors at the Global Network of People Living with HIV. Welcome to our podcast series called Leadership Now. Today we are joined by Dr. Mumbi, who will actually introduce himself, and really quite excited to have a conversation with you today. Yeah, so you can just introduce yourself and let us know what do you do, and also I would like to know what brought you into the HIV response.
Okay, my name is Mumbi Chola from Zambia. I'm based in Lusaka with the Center for Infectious Disease Research in Zambia. It's one of the top research NGOs in the country, doing a lot of work across different disease areas. And I joined them, I think, almost 2 years now, which was pretty much my first foray into the HIV space. Yeah, before that, I was mostly more into research, but my current role has transitioned me more into the advocacy space. Yeah, and what kind of led to where I am now is, I think the idea of the African-led HIV control working group, which is primarily my focus of work. Yeah, so I'm part of the secretariat for the working group based in Lusaka, hosted by CIDES. And the basic idea is to kind of push or advocate for an African-led HIV response. So with Africa bearing the bulk of the burden of the HIV response, we have the experience, the know-how, and everything that we need to pretty much lead and drive the agenda, considering how different our epidemic is compared to the global north and even Asia and other parts of the world. Our dynamics are a bit different in terms of transmission and so on. Even within the continent itself, there are quite a lot of disparities, even considering the progress that we have made. So we think the time is now for Africa to step up, own the response, lead the response, drive the agenda, and lead the innovation for us to get to the 2030 targets and beyond. So we need to craft a vision for what we think it will take to sustain the gains that we have realized to date, and then push and accelerate to meet the 2030 targets and also beyond that. Yeah.
Great. And I just want to know from your side, I mean, when you look at, like, in the global north, the current, like, framing of the current moment, particularly with the working group, how have you guys framed the current moment that we're in these different narratives? There's one of a crisis, and I like what you said earlier on around taking the response back to Africa. So I think you working in this working group with different sector leaders, how has been, like, the first reaction and the first thinking about where we are right now?
So for us, we've been saying this for the past, I think, 2 years or so, that funding and leadership from the global north is not infinite. It will come to an end. You know, it will end at some point. And there were indications in the global HIV response in terms of flatlining and funding towards HIV over the past couple of years. In some cases, even it has been kind of declining. HIV has been deprioritized with the push for pandemic preparedness. You have climate change and all these other global priorities that have cropped up over the past couple of years. So what transpired in terms of the US changing their policies towards funding for AIDS and HIV specifically kind of brought forward the timeline of what we've been talking about. So our thinking is this is an opportunity for us to rethink how we want to move forward with our HIV response. We need to think through what it will take in the short term. What are, like you said, everyone is kind of in crisis mode, trying to figure out how to manage, the breakdowns in the health system as a result of US government policies. So even as we are trying to mitigate, what's the shocks that we're experiencing at the moment, we still need to have a forward-thinking lens, because as we think through the current crisis, the short term, we need to start building systems that will carry on beyond the current crisis. Yeah.
And Dr. Mumbi, when we say country ownership, for someone who doesn't understand what that means, can you maybe just explain to us what kind of like a health system do we come from, particularly when it comes to HIV, in the most simplified way, when there was a donor funding, right. And maybe just give us like some country examples.
Right. So HIV has been largely donor funded, and we kind of have a parallel disease-specific system. So every investment that has been put in has been towards, building. It could be HR capacity, data systems, supply chain, and so on, to make sure that, every available service is provided the best possible quality, as conveniently as possible to the patient, which is kind of different from what happens in the rest of the health system. So with the withdrawal of funding now, we are having HIV patients having to access healthcare in a different format from what they're kind of used to. And I think from discussions during the Leadership Summit here, we've had presentations and examples, for example, within here in Kenya, where patients are accessing their services, treatment, and so on through outpatient departments. And so because of that, they're having to queue up and wait for long periods of time to get the necessary healthcare. And it's kind of, it's not what they're used to. So there's, discomfort, if I can say that, in terms of accessing services in that format. But that is essentially what the whole health system has been for people who are not living with HIV. They have to get in early, before even the health personnel report for work. So they come in early, queue up, and then they have to wait to be attended to, and so on. So I think going forward now, it's about how do we then improve the entire health system to be able to cater to not just people living with HIV and the other ailments that they might experience, but for the rest of the population as well.
Great. And what I'm hearing you say is that so with the donor funding, it created another health system within a public health system. Yes, exactly. And now people are having to go back to the health systems through their governments. Exactly. And how do you then foresee, and maybe based even from your data research, what do you think then, more realistically, what would governments can, because also we're talking about financing, right? And governments will have to also, they can't provide the previous infrastructure because that was donor funding. Exactly. Someone in today's panels talked about, we had a Lamborghini, and now we are going back to a Golf 1, maybe, or maybe a Corolla. Exactly. And what is more realistic as we sit here in terms of like prevention from your side, like PrEP? Do we foresee PrEP in Africa continuing, particularly being funded by governments? Is it more realistic or not? Do we see treatment being the biggest priority? Do we see things like communication, like public awareness, as a thing that's being prioritized? What's your opinion on that?
Right. So, like we said, we had like a Lamborghini kind of, with the parallel HIV system. But this is where now we're saying countries need to own and craft the response going forward. So then it will boil down to the countries to kind of figure out how this system will work going forward. So already we're having, because of the push that we've been forced into, people are kind of rethinking how to deliver the service and so on, while still trying to maintain, quality service and so on. So it will become more what word would I, what can I use? So we'll kind of need to redesign the HIV systems, even because we're kind of merging everything now. So data systems will have to kind of be redesigned, and so on and so forth. And as far as financing is concerned, we'll have money coming from one pot. So then it will come to the governments and implementers, the ministries of health and so on, to kind of decide what the priority is. Of course, for now, the thinking is, the push is to try and maintain treatment services and so on as much as possible. But in terms of prevention, we probably might have a push for, tools and interventions, for example, condom use and social behavior change and so on, because, voluntary medical male circumcision and the like, because they have demonstrated, effectiveness in prevention as far as HIV prevention is concerned. PrEP is definitely a brilliant tool to help us get to where we're going in terms of reducing new infections. But then it will become an issue about how cost-effective would it be for governments to procure it on their own, and do they have the resources to buy the necessary volumes to give to at-risk populations, or do they have to rethink which populations they have to focus on as far as providing, for example, injectable PrEP and so on. So governments or ministries and will have to kind of rethink how they design prevention interventions, and
and probably we'll just choose, like, as you just said, because of now coming back to the public health system, and prioritization is all the diseases.
Exactly.
So the luxury of the different kind of like tools that we had, we might see maybe in a long term come back, but for now, the biggest priority could be to shrink it, particularly because we do not have the same pocket of money, particularly that came from governments.
Exactly, because if you're getting money from the same pot, you have to look at other disease areas, like you said. So how then would you justify buying large volumes of injectable PrEP at high cost against maybe buying a machine to scan for breast cancer and so on? So there'll be those trade-offs that will have to be made, and decisions in terms of how we allocate resources that are pushed forward for health as a whole. So that's where now prioritization will come in terms of what is where do you get the most bang for your buck, for example. But and then how do you kind of craft, or how do you decide on where to put money, if it's PrEP, if it's condom use and so on and so forth. So all those nuances now will start coming in because we're getting money from the same pot. Yeah.
Great. And another question that I just was thinking as you were talking now is around, what do you think then, as PLHIV networks, what do you think is our role particularly in Africa, right? Yeah. When then the governments take over the ownership, and then how do you see us really working within the system?
Right. I think we have to kind of look back from where we are coming from. Before we had scaled up testing and treatment and so on. Before all these interventions came through, people living with HIV and their networks were the ones who were at the forefront in terms of delivering care to people before, when things were really bad at the time. And even in terms of implementing those tools to scale up access to treatment or prevention services and so on, people living with HIV have been at the core of pushing forward those interventions. We wouldn't have gotten to where we are in terms of the targets, the 95, 95, 95 targets, without the commitment from people living with HIV to make sure they stay on treatment and achieve viral load suppression and so on and so forth, so that we drive down infections. So going forward, we still need people living with HIV to be at the core of the response. It's just a matter of now trying to rethink as we redesign our response. How then can we bring, people living with HIV back into the fold and build that relationship with ministries of health or the governments, as it were. Yeah, so it will be a matter of how then do we engage, build multi-sectoral responses, bring in non-traditional stakeholders. For example, Ministry of Education, you've got ministries of finance and so on, people who make decisions on budgeting and so on. How do you bring all these different stakeholders so that you kind of look at things from different perspectives and so on, but still at the core, we still need people living with HIV because they still remain essential to driving down infections. Because as we make sure everyone gets on treatment, stays on treatment, and we are effective with our prevention, then we will get to a point where we do not have HIV as public health.
And if there's like, I mean, we know that I don't think donor funding is going to completely go out.
Yeah.
If I was a donor, particularly maybe thinking of funding the country responses and supporting governments,
right,
what do you think should be not even an objective, and what should the donors stop doing, particularly as we really rethink of country ownership?
I think, in my opinion, it will boil down to what support the countries need from the donors. Because if we have the African countries drive the agenda, determine what their priorities are, what they need to be done, what they can, cover as far as expenses or resources, financial resources towards the HIV response, then they can be able to say, okay, we'll take care of treatment, we'll take care of A, B, C, D. Then we'll need, donor support. Maybe is it strengthening health systems or supply chains and so on, data systems and all that. So then, with that understanding of our own priorities as far as what we need to do for our response, we can then bring in external support in specific areas where we think we might not have the capacity, and then they help us build that capacity so that we strengthen our health systems as a whole.
Great. Yeah. And just for the last question now, what do you then anticipate, particularly even from just by being in this meeting with the PLHIV networks, what organizationally, what do you think are the organizations we need, particularly because we come from an era of course, we came from crisis, right? And in a moment of crisis, it's normal that then movements are built, right? And it's to respond to that particular problem. And then after that, what we saw is a lot of investment from donors, right? And then to kind of like build the infrastructure. And, but a lot of our work was donor funded by projects to support whatever priorities that the donor was interested in.
Right.
And now, I think having to get to this point where now we also have to reimagine ourselves, you know, what would be the advice just based on the conversations that you've seen, particularly from PLHIV networks, in terms of like really rethinking about redesigning our own organizations? I hope it's not a difficult question.
No, it's not. Not at all. I think it will boil down to people living with HIV and their networks coming together and having a strong voice. Because without being organized, it will become difficult to kind of push for a seat at the table. Because if we are fragmented, you have different groups trying to engage the ministry and so on. Imagine yourself as being, a minister of health. You have one group coming to you saying, no, you need to engage people living with HIV. And then tomorrow another group comes, the other day another group comes. So I think it will start with coming together and strengthening the networks so that even as we engage with governments to, we call on governments to deliberately and meaningfully engage people with HIV and the communities, it's with an understanding that we are all, we are all going in the right direction. We understand what we need, what we want to get from, or what we want to bring to the table as we, seek to collaborate with the ministries going forward. So we need to come together as, people living with HIV, strengthen their networks, bring forth their expertise, their lived experiences, their knowledge as far as the disease itself, how to manage it, and so on and so forth, so that we, kind of demonstrate value addition, like what we bring, all the expertise that we'll bring to the table as our networks and our ability to coordinate, effectively implement programs and so on and so forth. And I think that would be probably the starting point. So strengthen the networks first, and then as we continue to engage with government, and then push for, also having a stake in decision making and shaping the agenda and the systems that come with implementing programs, particularly within communities.
And if you were to just summarize to anyone, just in closing, if you were to summarize to anyone the future
right.
of the HIV response, how would you, for someone who's not even in the space, how would you summarize it? What does the future look like?
I think the future, I would say, is what we make it, depending on how well we can, get together different stakeholders and think through how to best deliver healthcare for people living with HIV and the rest of the population within, our health system that we have built and been trying to improve over the years. So the HIV happens in the communities. HIV is managed at the communities, particularly prevention and so on and so forth. So the community is the battleground for HIV. So we have to make sure that we have communities at the core. Yeah.
Thank you. Thank you so much. And I really appreciated what Dr. Mumbi told us about, that these conversations have been coming, that, countries have, particularly in Africa, have been thinking about taking the HIV response back into their own continent and country. And it just happened that it was cut as earlier as possible. But there are really great opportunities for us to look ahead. So thank you very much for joining us.